Hello everyone, my name is Saisha and today I'm going to talk about the topic rabies. Rabies is a very fatal disease affecting the central nervous system, that is, it affects ultimately the brain. Now, rabies is caused by the virus called as the rabies virus. This rabies virus belongs to the family called as the Rhabdoviridae family, and the rabies virus belongs to the genus called as the Lisa virus. Now, the rabies virus has a very unique shape. The shape of this rabies virus is like a bullet, okay, like a bullet shaped, somewhat like this. Now, the rabies virus is made up of an envelope which is made up of a lipid called as the lipid envelope, and internally this is lined by a protein layer which is called as the matrix protein. The rabies virus, it contains a single-stranded RNA, that is a negative sense single-stranded RNA. Now, this rabies virus, it has two very important antigens. One of the antigen is the glycoprotein G. Now, this glycoprotein G is present as spikes on the outer surface of the envelope, and these spikes help in binding with the acetylcholine receptors in the neuromuscular junction, which is very important for the pathogenesis of this virus. The second antigen is the nucleocapsid. Let us move on to the transmission of the virus. How does the human get this virus? Now, the human gets this virus when an infected rabid animal bites a human being. Now, this can be in the form of a deep bite, in the form of a scratch, or the saliva being transmitted to the wounds of the human. Now, certain animals who can transmit this infection is 99% of the time it is always a dog which transmits this infection. Other animals like bats, foxes, jackals, raccoons, they are also capable of transmitting this infection. Second way is when the saliva of this rabid animals is transferred to the fresh wounds, the wounds of the human being can get the infection. Another way is by inhalation. This mostly occurs in the people working in the laboratories. Next is organ transplantation, cornea transplantation. Now, there is no risk of transmission of the disease in certain cases, like in case of certain animals. Now, animals like squirrels, small rodents, your mice, rats, there is no risk of transmission, that these animals cannot transmit the disease. Next is human to human transmission. That is, suppose a human being who is infected with the rabies virus bites another human being, there is no risk of transmission here. Next is eating the raw meat of a rabies infected animal or drinking their milk does not transmit the virus. Moreover, touching the urine or touching the blood, touching the feces does not transmit the infection. Let us talk about the pathogenesis. For pathogenesis, let's take the example of a dog, a rabid dog, and a human being. Now, let's say this rabid dog bites the human being at the leg. Now, at this site, the virus is present in the skeletal muscle of this human being. In the skeletal muscle, the virus is going to replicate over there. It replicates locally at the site of the bite. After that, the virus is going to bind to the acetylcholine receptors in the neuromuscular junction in the muscles. Next, once it binds, the virus ascends upwards into the spinal cord. Once it is in the spinal cord, the virus multiplies further. Again, it ascends upwards into the brain. In the brain, again, it multiplies further. Now, two very important sites in the brain where it is present. One is the hippocampus and the other site is the cerebellum. Once the virus is over here, then it starts spreading to different parts of the body. So, one, it spreads into the salivary gland. Now, salivary gland is a very important where the virus is shed. For example, in the rabid dog, the virus is spread by the saliva. Next, pancreas, it goes into the kidneys, goes into the skin and the cornea. In the brain, there is a presence of Negri bodies which can be seen after you do a brain biopsy. Let's talk clinically. Clinically, First is the incubation period known as IP. Now, incubation period is the time where the human gets exposed to the virus till the time you start getting the symptoms. Now, this period in rabies can vary 1 to 2 months till you get the symptoms. It can go up to 1 year. In certain rare cases, there was one case where the incubation period was as long as 19 years. Next, now, talking a little bit more about the incubation period, as I said, it can vary from 1 to 2 months. That is, you can, for the symptoms to appear, it can take up to 1 to 2 months or a year. Now, this incubation period can be less or it can be more. Now, let's take an example of a human being. This human being is being bit by a rabid dog at the lake. Now, for this virus to travel from the lake up to the central nervous system, that is the brain, is going to take more time. So, the incubation period is going to be more in this case. Let's take another example of a human being. Again, a rabid dog bits him, this time on the hand or say on the neck area. Now, for this virus to travel from the hand or the leg to the central nervous system is going to take less time than the time taken to travel from the leg to the central nervous system. So, here the incubation period is going to be less, that is, the symptoms are going to appear much early. Now, this incubation period time can be less in which cases? First of all, in cases of children because of their short stature. Second is the bite, if the bite is on the hand or on the neck or anywhere near the central nervous system. People who have low immunity like transplant patients, HIV/AIDS patients, etc. Now, next clinical thing which is very important, let's talk about the acute neurologic phase. Now, this acute neurologic phase can either be of two types. One is the furious rabies, also called as the encephalitic rabies, which occurs in 80% of the people, majority, and the other one is the dumb rabies, also called as paralytic rabies, which occurs in only 20% of the people. Now, a very important feature of furious rabies is hydrophobia, that is the fear of water. This is because the act of drinking the water or even thinking about drinking the water causes very painful spasm of the neck muscles. So, the patient is very afraid to even drink water. Secondly, there is also aerophobia. Aerophobia is the fear of air. The patient also starts exhibiting very bizarre behaviors and he starts getting hallucinations. The patient becomes very excitable. The level of anxiety increases in this patient. Next, we also see the increase in salivation, and because of this there is increased foaming of mouth, which is a very characteristic feature. There is increase in lacrimation, increase in perspiration and increase in sweating, which is also seen. Coming to the dumb rabies, the most important feature here is flaccid paralysis. Flaccid paralysis. Over here, we do not see hydrophobia. So, person does not exhibit the fear of water. Basically, all the symptoms seen in furious rabies are absent in dumb rabies, but furious rabies accounts for 80% of the people. Now, ultimately, the person is going to go into coma and death is going to occur within 14 days of being in coma. Now, this is a very preventable disease. How can you prevent it? One is by vaccinating the dogs with the rabies vaccine. Next, tens and thousands of deaths occur due to rabies, mostly in different parts of Asia and Africa. And here, pre-exposure prophylaxis can be given to certain people who are more prone to it. The most people who are affected are the children who are in the age of 15 years. Now, there is also a vaccine available for rabies, which is the post-exposure prophylaxis. That is, immediately after being bit by the rabid dog, you can get this vaccine which can prevent the rabies virus from going into the symptomatic stage. That's it about rabies. Thank you so much for watching. If you liked my video, please like, comment and subscribe to my channel. I will be getting more such informative videos. Thank you so much.